Hello, everyone. In this lecture, we continue our discussion of prejudice and discrimination by examining LGBTQ plus health and wellness. Chapter 7 explores how social conditions influence health outcomes and why LGBTQ plus populations experience distinct health challenges within the United States. Health and wellness are shaped by more than individual choices or biological factors. The chapter emphasizes that access to health care, social support, and inclusive environments all play important roles in determining well being. For LGBTQ plus individuals, health outcomes are closely connected to broader social experiences, including stigma, discrimination, and access to affirming care. One important factor affecting LGBTQ plus health is access to healthcare and health insurance. Many individuals encounter barriers when seeking medical services, including financial obstacles, lack of insurance coverage, or limited availability of providers knowledgeable about LGBTQ plus health concerns. Access improves when healthcare professionals create affirming environments in which patients feel safe disclosing information about their identities and experiences. Open communication allows providers to offer appropriate prevention, screening, and treatment. The chapter also highlights the importance of culturally competent healthcare. LGBTQ plus patients may avoid or delay medical care if they anticipate discrimination or misunderstanding. When healthcare providers lack knowledge about LGBTQ plus health needs, patients may receive inadequate or inappropriate care. Affirming healthcare relationships therefore contribute directly to improved health outcomes. Another key concept discussed in this chapter is self efficacy in health. Self efficacy refers to a person's confidence in their ability to make healthy decisions and manage their well being. Access to accurate information, supportive communities, and necessary resources strengthens individuals' ability to maintain physical and mental health. Mental health represents a significant focus of the chapter. LGBTQ plus individuals experience higher rates of stress, anxiety, depression, and related health concerns compared to the general population. These disparities are not attributed to LGBTQ plus identities themselves. Instead, they are linked to social stressors such as stigma, discrimination, and social exclusion. The chapter builds on earlier discussions of minority stress by explaining how chronic exposure to prejudice affects long term health. Experiences such as rejection, concealment of identity, and fear of discrimination can create ongoing psychological strain. Over time, this stress contributes to both mental and physical health disparities. Importantly, the chapter emphasizes diversity within LGBTQ plus communities. Health experiences vary widely, depending on intersecting identities such as race, gender identity, socioeconomic status, disability, and geographic location. Intersectional approaches help explain why some groups face greater barriers to healthcare access or experience heightened vulnerability. The chapter also addresses preventive health and wellness practices. Education about sexual health, disease prevention, and routine medical care plays a critical role in improving outcomes. Inclusive public health initiatives that recognize LGBTQ plus experiences help ensure that prevention strategies reach diverse communities effectively. At the same time, LGBTQ plus communities demonstrate significant resilience. Support networks, community organizations, affirming families, and inclusive policies can promote positive health outcomes. Social acceptance and institutional protections contribute to improved mental health and overall well being. The chapter concludes by emphasizing that improving LGBTQ plus health requires both individual and structural change. Expanding access to inclusive healthcare, increasing provider education, and addressing social inequality are essential steps toward health equity. Understanding LGBTQ plus health and wellness allows us to see how social environments directly influence lived experiences of the body and mind. Health disparities are not inevitable. They reflect social conditions that can be transformed through education, policy change, and community support. As we move forward, this discussion reminds us that health is deeply connected to social justice, inclusion, and the ability of individuals to live openly and safely within their communities.